Well, hello and welcome to the Well After Hours. I am your host, Beverly Allen, and I'm always thrilled to meet with you every week around the Well After Hours. And in fact, I want to invite you to become part of the community of the Well After Hours by liking and sharing our conversations and also subscribing to our channel because you can help us make an impact on the world because that is really our mission. We have so many phenomenal guests and voices that come that share their expertise and their professionalism that can impact lives and help build faith. So if you help us do this, I will be so appreciative. Well, I'll say this now. September, we're almost at the end of the year, but September is a very important month because it is also recognized as National Suicide Prevention Awareness Month. And that is very important, but not only the month, but there is a particular day that has been designated and recognized to a certain group of professionals that before I hadn't even thought about. We are so busy using them to help get ourselves together that we don't think about who's helping them. And that's September the 17th, which is National Physician Suicide Awareness Day. Very important day. It's a day that aims to draw attention to the high rate of suicide among medical professionals and reduce the stigma around seeking mental health care and also encourage supportive change in the healthcare system. So, to do that, the Well has reached out to one of those powerful voices in expertise and professionalism in my special guest, Dr. Kelly D. Holder, PhD, a licensed psychologist and nationally respected leader in the field of mental health. Dr. Holder has dedicated her career to advancing emotional wellness, reducing stigma, supporting both patients and healthcare professionals, and navigating the unique challenges of mental health. And with a deep understanding of the pressures physicians face from burnout to depression and even suicide, Dr. Holder brings both expertise and compassion to this vital conversation. She's a sought after voice on creating healthier medical environments and building resilience and reminding us all that even those who care for others must also be cared for themselves. I want to welcome Dr. Kelly Holder. Dr. Holder, thank you so much for coming to the Well. I appreciate you taking the time to be with us. I don't know how you do it with all that you do, but I certainly appreciate it.
Thank you for having me. It's an honor and a privilege to share and to have these kind of discussions. So thank
Yeah.
you so much.
They're so valuable, and we're so blessed to be able to have someone of your profession and caliber to come and talk on this vital subject. I mean, you are a consultant, a speaker, clinician, an educator, an advocate for wellness, and especially among medical professionals, as well as also an author, I want to say. Yeah, that we'll get into later on too, as well. It's so nice to have you here. And, before I get started, I would like to have the viewers just hear a little bit from you. I know we had your bio in the opening of the show, but it's nice to hear your voice. Tell us about some of the things you're doing now briefly.
Yeah, so I I I count it an honor to get to do the work that I do. And so I have just left one position and I'm about to start a new one. For the last 4 years, I've served as the Chief Wellbeing Officer for the Warren Albert Medical School. And it was a wonderful position where I supported students, our faculty and staff, did some work with our residency, individuals, folks who are training to become physicians past medical school. And it was a spectacular honor and privilege to serve and work with those teams and work with those individuals. And now I'm transitioning into a role as Director of Oncology, Mental Health, and Wellness for the Cancer Network of West Michigan, which will include working at Trinity Health in their system and working at University of Michigan Health West within their system as well. I'll be supporting not just the patients, but also building wellness and mental health support for the colleagues, the physicians, nurse practitioners, and nurses that take care of the patients within this network. So I'm really excited about building this program and working with those teams.
Wow, that is amazing considering all, all that you had done. I mean, I could take up about 30 minutes just talking about all the things that you have done, but you just left and now what you're going into. I mean, that is absolutely amazing. I'll let my viewers know that you have a PhD in clinical psychology from Loma Linda University, as well as an MA in psychology from Loma Linda University, and a BS in biochemistry from Oakwood University.
Yeah.
I tell you, not to mention all the appointments you had, all the specialized training. I mean, that is such a blessing. And to see actually a woman of color, that makes me even more proud. But I'm just, and a woman, that's amazing. But dealing with this particular subject is not an easy subject, and you looking at some of your writings, you bring out so many vital things. I was alarmed at the statistics about how many physicians actually commit suicide. There's one at least every day. And they say that, millions of, at least a million Americans, people in this country lose their physician, one physician to suicide.
Yeah. Yeah,
And
it's
I,
alarming.
I mean, I don't, what you maybe you can help us with what the broader picture is as to some of the whys and some of the facts that, actually bring a medical professional, because we always feel like, doctors, they have their career, they're so successful, and which many of them are, but we don't know some of the underlying issues and things that they have to deal with,
Yeah.
that you point out so well, especially burnout after
Yeah.
the pandemic, from the pandemic on.
Yeah. There's so many layers. It's a really big conversation. I think at the heart of the matter is this idea that there are people who are helpers and there are people who get helped. And we put ourselves in these boxes and it starts really early. So it can start as early as elementary school when someone says, "Oh, you want to be a doctor. Oh, you want to be a nurse, right? You're a helper, right?" And so there can be pressure that is applied over time through high school, through college, because of what you have to study, because of what you have to learn. And there's ways of being that become natural and normal, but often can separate and don't allow people to get the kind of support and the help that they need over time. And again, I'm not blaming people as individuals, but as a society, right? We start to craft certain narratives. And along with those narratives include the high pressure and demands of being in the sciences, the high pressure and demands and the things that happen within medical school, that happen within residency training, and not to mention how our health system functions at large, right? Which can create some challenges for the people who have to work in those systems. Then you can layer in all the interaction effects that they have, or the effects of the interactions they have with patients and being a caregiver and the demands that that feels to carry the weight of some of the diagnoses and the treatment and the challenges that come. Also, with those challenges within healthcare, what happens when the system breaks down and I, as a provider, really care, but things are really not going well in terms of wanting to care for my patients. And then, as providers, as physicians, they have their own lives. They have spouses and children and love lives, right? Fertility and whatever health conditions they carry on their own. And so all of these increases to have this multitude of impacts and effects that can impact a person maybe having these thoughts around suicide. One of the things that has been really important that has been done has been the work of the Dr. Lorna Breen Heroes Foundation in making it possible for physicians to ask for help. There have been lots of laws or licensing regulations where they ask questions about, are you getting mental health care? People having fear around disclosing, asking for help, and that impacting their ability to continue to do the work that they do, which has decreased folks wanting to ask for help or wanting to raise their hand and ask for help because of the stigma that's involved. And the Dr. Lorna Breen Heroes Foundation has not only aided with decreasing stigma, but helping with changing laws and changing licensing regulations within states and within hospital systems so that people can feel safer raising their hands and saying, you know what, I might need some help. So there's been so many things, but that was the one thing I really wanted to highlight.
Yeah. Oh my goodness. Please feel free to highlight anything that may come to your to mind because um, you know, in thinking about, as you mentioned, they do have separate lives too, apart from their professions, as most professionals do. But
Yeah.
theirs doesn't leave them. So it follows them home, and they can get a call in the middle of the night or anything, and can happen that can take them off course away from that. And I wondered, and this is just something that I just was thinking when I'm thinking back from years ago, before there were group insurances where, kind of doctors all got together and they formed like their own smaller group instead of just a hospital group, they had their own private medical, groups that you could go to. Um, and when the doctor just had his own private practice, and we think about the stress involved, now doctors are so overwhelmed. Not only do they have private practices, some of them are connected to um, daycare facilities, rehab facilities, senior facilities where people are sick, and they've got all those patients plus the patients from the hospital. I'm like, how do you keep up with all that? And those institutions are there to also make money. So they reduce staff, and I have seen that happen in facilities where I've had family members that I had to go and care for, or watch over. Had I not been there, some things that could have happened because even nursing staff is reduced. They put more work on staff and they're burning out, even the nurses, some of them, And you do wonder, like, where do they get help? You try to pitch in and do help and say, oh, I can do this, while you do that, or I'll bathe them, or I'll do this and that, because it's just, there just doesn't seem those in place. Like you say, a system is in place that doesn't take into consideration the staffing, and I would say ultimately the patient, because you're not providing enough care there. And it's like how they just think it's just a normal day. They've accepted that the staff has kind of accepted as normalization because it's like, what can we do?
Yeah, gets really tough depending on what the limitations are. When we're talking about staffing, that just gets hard, right? When you don't have enough human capital to do the work that needs to be done. And we can't leave out this idea that when we show up in a healthcare system and we need help, we want to be cared for, not just the checklist of things that needs to be done. We want our providers to be compassionate and thoughtful. And if we forgot something or we're running late, we want people to extend grace to us and support us. And we know that extending compassion and connection can be really hard when time is limited, right?
Mm.
So we're expecting all of this goodness when we come into being in the patient role. And oftentimes providers aren't given all the space and time they need so that they provide us with the care that we're seeking to begin with. Like, we'll be upset, right?
Mhm.
If our doctor's short with us, if the nurse didn't smile, if the person who brought us in the room doesn't say good morning, you know?
Mhm. That's so
We
true.
want a certain level of care, and then the systems are at a limit. And so we're asking people to do things that can be really hard when there's a crunch for time and there's not enough people to get everything done.
Yeah, boy, that is so true. And um, you seeing overall how knowing how the system works and working towards trying to, help um, physicians and mental care professionals um, actually get more help. What do you think is lacking in the system itself that can actually that they things maybe some things that they really could do to help bring about change?
Yeah. There are a lot of systems that have worked really hard at this and that they've hired people to be part of the C-suite staff to aid with this and people who are part of department leadership and part of team leadership that are really thinking about what does it mean to care for the caregiver and how do we keep that in sight as we are planning how we implement the work that we do. And so there are a lot of really good examples of things that have been extremely helpful in aiding folks. And so I'll just name a couple of things. The um, the American Medical Association has a practice tools function, and there is a physician by the name of Christine Skinsky, who has guided a lot of this work around increasing and improving the workflow so that providers, physicians in particular, have more time at the bedside with patients. And so just simple things around placement of printers, right? How far do you have to walk to get those things? What does it look like to do documentation? Do you need a scribe? There's a lot of people working on implementing AI scribes in the patient room. Again, that decreases the amount of paperwork physician has to do afterwards, which can increase the amount of time that they are at the bedside or they are working with the patient. Most people who have gone into medicine, they've gone into it because they want to help people. And so if we can aid them in doing more of that, not in the paperwork sense or these other tasks that feel disconnected from patients, we can increase their meaning and increase their joy in regular days. Some of the other things that have been really helpful is increasing peer support within teams. There is some really great work that has been done at Mass General. It started with, now I can't remember the person's name, Joe Shapiro started one of the seminal physician peer support programs. And being able to have a peer that you can reach out to for support kind of lowers the bar. And so then you can have these conversations, and then if people need more, they can get more. But the other thing that it does is that it increases camaraderie and the time people can spend together so that they can just get that emotional support that they might need around all the tasks that are happening and all the challenges that are happening in the work environment. One of the things that I think is important is making sure that there's an ease of access to mental health care for healthcare providers that given a busy schedule, given a busy day, that they don't have to search through lots of materials to find out what it is, that it's easily accessible, and that the person that they work with understand medical culture, healthcare culture, so that they can kind of guide them in a way that makes sense for the kinds of lives that they're living. There's a lot about being in healthcare and being a physician, being a nurse that is just not part of the rest of our lives. Like those of us who don't do it, we
Yeah.
would say, well, that's just not normal. Some of the things that they're exposed to, some of the things that they have to face on a regular basis. And while people get really good at doing these jobs, there are things that happen that they need space to process, decompress from, and where their humanity is honored and appreciated and elevated. And so I believe mental health care that is culturally appropriate in terms of what it means to be part of medical or healthcare culture is really necessary and needed for our healthcare providers. And so that's another thing systems can do is just making sure that those things are easily accessible and that they're accessible in a way that can be used for their providers.
Wow. Um, Another question I have is who decides or how is it determined how many patients a doctor must see in a day?
I don't know how that's determined. It is really interesting. Each institution or places where people work, they make these benchmarks in terms of how a physician gets paid. And it's often in terms of some sort of numbers of how many patients come in. My guess is that there's some actuarial kinds of things that go into that in terms of how much can be made and how much it is to pay the physician plus pay for the physical locality plus support all the supportive services. I'm sure that these institutions use some sort of algorithm to figure out how their system can sustain existence and then figure out, okay, well, this means our providers have to see this amount of individuals. But
Wow.
those are conversations that I haven't been part of.
I would imagine only certain people might be privy to that because it's business in combination with healthcare. So, you would hope that some of the people who have to give the care would be in on it because,
Yes, that
being
is the hope.
overloaded, is overwhelming with patients.
Yep,
I mean, I've heard doctors express, you know, um, their discontent with how systems are working now, which made me think, was it better when a doctor had his own private practice as opposed to going into a group practice? Because then he could kind of settle on how many people
right,
he sees. But no longer in a system, you have to see a certain number of people. And that to
right,
me, it's just overwhelming. I don't know.
right. Yeah, yeah,
That
yeah.
brings on, when we start talking about the things that bring on the mental health problems is burnout.
Yeah, so I like to think about the health or the well-being of healthcare providers as being in a spectrum. So we have, just being well, which most of us, if we're honest, are probably just on the edges of being well, if being truth. Because then the next piece I would describe as some level of stress, right?
Hmm.
Stress that comes in waves. Um, when we talk about it in general, usually that stress is manageable. You know what's coming, you know what to do with it, but then that stress can become chronic. And once the stress becomes chronic, or the stressors are chronic, then we can have situations where people can become burnt out from whatever the stressor might be. And that could be around communication, interactions. It could be around practical things around patient care. It could be around the heaviness of the job. It could be any of the stressors could turn into burnout over time when the stressor becomes chronic. Now we know that burnout does not mean someone will have a mental health disorder or diagnosis. However, we do know that if the burnout lasts too long and the stressors continue to increase, it creates an environment, right,
Yeah.
for someone who may not have had depression to have depression, or someone who might not have had anxiety to have anxiety. And so there are different kinds of techniques we want to use around managing stress, then managing and dealing with burnout. And then we have our mental health conditions, anxiety, depression, post-traumatic stress disorder, the full gamut of things. And those are things that need to be treated and need to be treated right away. They're not While the things we might do to mitigate burnout could be helpful for this group of symptoms and things, they need to be dealt with pretty much head on. We want to make sure folks are in treatment. We need to make sure that they're doing the things that can decrease the symptoms involved in them and that they can feel healthy and whole and like a regular person because we know 1 in 5 persons in all of the US, or is it down to 1 in 4 now? have a diagnosed mental illness. And this is just everybody, regular folks, all of us, right? A diagnosed mental illness. So we know that our healthcare providers, physicians, nurses, physical therapists, whomever fall into this category of our humanity, right? And so we are going to have folks who are in this category. And how is the work environment increasing the stress that can come and exacerbating those conditions? And so just making sure that they have access to care and can get cared for. So like the rest of us can still have meaningful work, meaningful lives, because again, in our humanity, we have all these experiences and we get to have them. It's part of just being a human being. But when we think about our healthcare professionals, we want to make sure that it is okay for them to continue to get help, continue to get support so that can show up in the spaces where we need them the most.
Wow. I there's a stigma around mental health, period. So I could imagine how difficult it must be for a physician or a medical professional, because the moment you say, I may be experiencing, some mental illness now, and I don't know what is the cross bridge or the crossover that brings you from mental wellness to mental illness. How do how do you type that? How do you
Yeah.
determine when someone is really has a mental
Illness. Well,
illness?
that's a good question. And there's a lot of factors that go into that. So we know that a lot of us come here with a certain brain chemistry and physiology that puts us susceptible from the beginning, right? Our parents have mental illness, our grandparents have mental illness, and we're going to inherit some of that. Some of us have had situations early in our lives that make us susceptible to having more challenges with our mental health, just because of the nature of the difficulties, challenges, or traumas that we've experienced. Then we also know that there are things that happen in our life that can trigger having symptoms of a mental illness. And so, because we know healthcare providers are exposed to significant levels of trauma on a regular basis, this kind of puts them in a place of susceptibility. There's something we call about vicarious traumatization. There's secondary trauma, where when people experience supporting someone else who has been through a trauma or a difficult situation on an ongoing basis, will carry their own symptoms just because of the difficulty in meeting those needs and supporting those needs. And that's a level of susceptibility. Oftentimes, at least in the spaces I'm in, when we talk about trauma, we talk about like more mental health kinds of things. But trauma is, watching people die, folks losing limbs, family members losing people who are important to them, someone's health not returning to the place where they wanted it to be throughout treatment. I mean, all of those are insults, and our healthcare providers carry those stories. We often talk about in healthcare when we are supporting folks with compassion and saying, when someone comes in, this is a regular day for you. It's the worst day of this person's life when they come into the healthcare system. So, healthcare providers are meeting multiple people on the worst day of their life several times a day and significantly over time. I mean, and that's the dramatic view of what it means to be a healthcare provider and work in lots of the spaces in which they do work.
Wow. Um, do most, well, it's very hard for a medical professional to come forward about that. Is there anything in place? I've heard in law enforcement there is, but I was wondering in the medical field where you have to have um, like a psychoanalysis of a person's health. to see where they are mentally, to make sure that they are, because they deal with so much that they have to maybe, I don't know, not pass every year, but at least see a professional within.
No, I have not heard of something like that. Yeah, I have not heard of anything like that. I know that there are lots of programs, training programs, and healthcare facilities that offer something that is like an opt-out program, which provides them with this opportunity to meet with a mental health professional or well-being professional and gets an opportunity to have a check-in, provide them with resources and tools. And again, in these places, they're opt-out. They don't have to, but it makes it easy for them to access support should they need that level of support.
I was wondering, if it were mandatory, um, that maybe it might make be easier for them to not have to make the decision. They do it because they have to, in a sense,
Yeah.
but not for a judgment, but just for there to be a safe
Yeah.
space where they could.
Where they could. I think in theory, I think that sounds beautiful, especially as a mental health provider. The other piece on the other side of that is that, there has been a lot of harm done for individuals disclosing that
Hmm.
creating something like that could feel unsafe. And the hope is that folks do seek out the care they need, whether it's within the system where they work or they're just their own mental health or own wellness or coaching or support services. And a lot of people feel really comfortable seeking those things out on their own, especially over time. When we look at um, I would say a younger generation of healthcare providers. They're willing to have those conversations and do them. Do they feel safe doing them in the institutions in which they work or they go to school? Some may not, just because of the history, right? If we
Yeah.
look back and see the things that have happened. And so, really, it's good to encourage folks to reach out, encourage folks to seek support and create healthy environments for themselves and create healthy environments within the system. But it gets dicey when you say, oh, someone has to seek help within the same system in which they work, if that makes sense.
Yeah, no, it does. It really does. Because we would all have a fear, because I'd have a fear of being exposed. I mean, you want to be honest and you want to be transparent, but what will people do with that transparency? In the end, I mean, unless someone really sees that your work is truly being affected, that they have to step in and say, wait a minute.
I
But
do have to add, though, because I work in this space and those individuals who do this work really hard to make these services confidential, make them easily accessible, make them happen for the providers. I know a lot of systems that have psychologists and other mental health professionals that they've hired to support their healthcare staff. And the ones I know, and probably even the ones I don't know, do an excellent and an amazing job. I just wanted to highlight some of the concerns people have in saying, well, do I really want to do this? But good programs are confidential and they just really make it easy and try to create a place where they can be safe, they can be heard, and they can get the support that they need ongoing.
wow, that's good to know. And some of the things that I mean, I guess it's not just one thing, it's many things when we talk about burnout.
Yeah.
What would you say are some, or in your experience, maybe from what you've heard or seen, or might be two or three of the top things that cause burnout?
Yeah, yeah. Um, for for healthcare providers, I really think one of the major things is how their time is used.
Hmm.
feeling like their time is respected by the organization, by their boss, by their manager, so that they're able to manage seeing patients, getting the things done that they need to do in a way that makes sense, without the extra stuff. There's this whole project they call growth, getting rid of stupid stuff, where organizations really look at what are the things that you're asking me to do that don't really add up to the work that I've come to do and the meaning that I want to make. And that looks different for different specialties, different kinds of work. And so I think that one would rank pretty high on increasing burnout. I really like looking at Christina Maslach's kind of definition of burnout. It has three components. One is this emotional exhaustion, like I don't have anything else to give. The other piece is this feeling of detachment, like you can't, when working with patients, it's hard to see them as people. You feel detached, or even your work, you feel detached from it. And then the other is this kind of lack of meaning, like what I'm doing doesn't really matter. Why am I even doing this in the first place? I describe these three things to kind of give an insight in how I see burnout and kind of the definition that I like to use. Because when our time isn't used well and we're just running and running all day, and we don't think it's adding up to the things that are meaningful or the reason why we're doing the job, or creating barriers between me doing the job that I want to do, it's easy for people to start to feel like why am I why am I here anyway? In worst case scenarios with healthcare providers, we definitely don't want them to get to this depersonalization, because that is the part where you can see a decrease in compassion and those kinds of things, because it's hard to see individuals, your patients, as individuals because of the burnout. And so we want to mitigate that as much as possible. So I think time is probably, and how time is utilized and honoring the time and being respectful of time is probably one of the highest um, causes of or impacts for burnout within this population.
Mm. Wow, I tell you, then it really sounds like one of the biggest issues is the system. Just bluntly put, it just seems like it's the system. The doctors are there, it's just figuring out how. It's like when when people design things, it looks good on paper. It looks practical. But if you don't get, they used to say that about the auto industry, why one was ahead of the other, because they listened to the people who actually put the cars together.
Wow. Yeah.
When in the medical profession, when you see how care is given and you get it from the professional's perspective, I know some doctors are even upset a little right now because it just seems like so much of the care is out of their hands. There's all a specific way. It's all, if this is the case, this is the symptom, this is what you do. It's not like the
The
doctor has,
protocols and
yeah,
all those things.
all
Yeah.
those things. So, I understand it really is quite a bit, quite a bit for them to go on. But, at this point, I just wanted to we're going to go to a highlight reel to take a highlight break, which we always do when we have a guest, and share a little bit about their path, their journey in their profession, what they do that helps actually the so many individuals to be strengthened to um, in their field of expertise, how they use that to help people perform better, to help them live better and function better. And so we want to do a little highlight on Dr. Holder, all that she does, so people can learn a little bit more about you and what you do. And we'll be back. We're not going away, so don't take a break. Take a sip of your favorite drink, whatever you have, your coffee, your tea, or lemonade, and we're going to just share with you a highlight reel on Dr. Holder and what she's doing and on this subject matter, and we'll be right back. Don't go away, there's more.
I came into well-being work in a very interesting way. I am a psychologist, and almost 10 years ago, I had this really great opportunity to start and run and build an office of student mental health and counseling at a medical school. And we did this work, the office grew. We didn't just take care of medical students, we took care of nursing students and graduate students, and then eventually medical residents, and then eventually our faculty and staff. And I found while I was doing that work that not only were we caring for their mental health, but we were noticing challenges in the system that was causing a resurgence of the problems that we were seeing. And so I was able to start to do some advocacy in our own healthcare system, go up in different places, and it provided the opportunity for me to take the role that I have now. I am fiercely passionate, clearly about mental health, but also about well-being and how we create a system that offers folks the opportunity to not have to sacrifice their own well-being while they are trying to serve other people.
Okay, well, we're back, and I'm sure you enjoyed getting all those highlights and learning so much about Dr. Holder. And we're going to provide all the information on how to reach out and contact her. Should you want to explore things a little further as far as to what she offers. She is a speaker. She addresses these issues, on a day-to-day basis, podcasts and other, social media platforms, as well as institutions that invite her to speak. So we're going to provide that for you. And coming back, Dr. Holder, to I said I wanted to speak about, because I also learned that female physicians face disproportionately a higher risk. Why is that?
Yeah, again, there can be multiple reasons to that.
Mhm.
One is just the gender disparity or gender difference, right? Just like almost every other profession, women are still working to reach the status that they want to within the field of medicine. And so while we do have a lot of women physicians, women still want to be heads of departments, chairs, lead organizations. And so dealing with sexism can be an impact. We're still making strides in certain specialties where there are hardly women in those specialties. So that idea of sexism can impact someone's overall well-being. Also, we know that in general, women carry a higher burden around managing family, right? We talk about the second shift, and female physicians are not exempt from that. So you have your female physicians who are working and doing all the things we talked about in the first segment. and still doing second shift, having to carry lots of the burdens around child rearing, support, not just even children, but think about taking care of older adults and parents and caregivers, like, sorry, I didn't mean to say caregivers, and
Yes.
taking care of, just
Yeah.
older folks in the family as well, too. So there's a second shift that could be childcare or elder care, or just dealing with all the other problems that happen, right? And so that creates another stressor or a level of stress for women as well. So I think some of those things go into it.
Hmm. I read something that you shared from your own journey of self-care, something that I read and feel that it will resonate with the viewers as well as myself. And you said, there have been times in my life when I wanted self-care to be a quick fix for stress or exhaustion. I had to learn that self-care is more of a steady presence than a miracle cure. When we approach it as consistent support rather than a cure-all, it can truly help us thrive. I think
Yeah,
that's so true and powerful.
it is true. It's true. And what gives it power is that it takes away this notion that I'm not doing it right. And again, I don't have any stats for this, but I could imagine that there are a lot of female physicians to become a female, to become a physician, you did a lot of things right, right? There's
Mm.
a lot of hoops to jump through, a lot of work that has to be done. And even if your process in getting there wasn't smooth, you figured it out, like figured it out at some point. And I can only imagine that some of the stressors in one's life and knowing the knowledge they have around physical health as a physician and the knowledge they had to be able to get where they are in medicine and in life, they that folks sometimes have this thought that I'm just not doing it right. If I could just figure it out, I wouldn't have so much stress. I could handle all these things. And there isn't, when it comes to taking care of ourselves and negotiating all these things, there is not a magic pill. There is not that one thing that will change everything and then you've got it right. We do take care of ourselves and learn self-care as an act of self-preservation, and so we grow over time. But there's no easy way out of this kind of situation. It really takes a lot of time and and kind of even holding some things that are uncomfortable to sustain oneself over time. So there's just not one thing that will fix it, and there's no miracle, and then there's no like, oh, I got it, finally got it right. There's only growth and it's self-improvement slowly over time.
No, that's so well put. And uh, I would ask you then too, because I want the viewers to know, as all my guests are, you're a woman of faith as well, and how much that plays into you know your life. That must be helpful.
For me, it's extremely helpful. Um, the role it serves in my day-to-day function is that I I believe that my life has great meaning and that anchors me. And then I also believe that everyone else's life has great meaning as well. And so the God who cares for me also cares for everyone that I intersect with or work with or support. And so um, my faith really helps me stay grounded as I'm doing the work. I am reminded that there is a call on my life and that I am enabled and have been given every tool I need for various situations. But I'm also reminded that God sends people as tools for support as well. And so it makes me not as hesitant to reach out to a colleague and say, hey, can you give me some tips on this situation or this diagnosis or building this program? What are you doing? And so it allows me to both feel secure and anchored, but also safe to reach out and get support, not just for the work I do, but for myself as well.
Hmm. Hmm. Oh, that is so good to hear you say that. I'm sure many people would be encouraged by that because it's so important when you can hear someone, a colleague or someone who is in the same, in that same professional vein, tell that, especially for women, because we do carry a heavier burden. We feel so responsible for so much. And that in itself is a weight, you know,
Yeah.
and I would ask you, what would you say to encourage any other uh, female professional in the medical care industry, as you are a wife, you are a mother, you are a working mom, in a medical profession that has to interact with people who are on the verge or on the edge, of
Yeah.
of of of, of trying to keep their bearings and their grounding, what be your I know your faith has helped you. What are some tips or strategies or things, I know along with faith and I know prayer that you could, tell or
Yeah.
share with other women things they could do, because time is such a factor, you know what I mean, because your kids want your time, your husband wants your time, they know the mommy goes to work, they think it's a 9 to 5, okay. When you get home it stops, it doesn't. Well, I mean, your husband understands that well because he's he's a doctor, doctor too, which makes it even more interesting how you two, I think you could do a master class.
It is like every day is not the same. And so maybe that's what I would start with is just saying, every day is not the same, and that can be okay. The first thing that came to mind, and it sounds counterintuitive, but I would say it is okay to go slow. Going slow is okay. You're going to still get where you need to go. I think there's a fear that if we don't move fast enough, we're not going to get all the things done. The best analogy I have for this is I'm gonna tell on my husband a bit, but we were driving somewhere and after we were taking my son to a doctor's appointment, and we drove separately because after it was over I needed to go one place, he needed to go somewhere else. And so once we figured out where to go, I called him as we were driving. I said, "You could go ahead and leave me," because he likes to drive faster than I do. "You could go ahead and leave me. I will get there. I'll meet you there. You don't have to," because sometimes we just like trailing together. But I
Yes.
called him and said, "You can leave me. And that way, at least if you get there before me, we'll be on time. I'm just
Hmm.
going to take my time. You
Yeah.
can leave me." So he says, "Okay." And I see him like take off in the car, right? He takes off, whatever. When I arrive and I pull up to the garage, he is at the gate of the garage. He hasn't gotten that far. And it reminded me, there used to be, maybe it's an Allstate commercial where the person's zooming and then they
Yes.
end up at the location at the same time. The that's honestly what happens, right? We think that if we just rush, do this, do that, right? We can get somewhere faster, get over this hump. And all we do is just run our wheels.
Hmm.
And
Hmm.
so as a mom, as a working person, I have 3 kids, and um I volunteer and do all these other things. I always tempted to rush. Like, okay, if I could just hurry up and get it done. And when you hurry up and get it done, what you end up doing is when you need to go to the bathroom, you don't. You're just like, no, I got to push through it. When you need to stop and get a sip of water, you don't. Like, I can't take those 2 minutes, 30 seconds to do that. I'm just going to rush and get this done. When you work like that, you don't stop, you don't eat lunch, right? When your body says, I need to stretch, I need to move, you don't go and take a quick lap around your unit or outside, right? So the rushing keeps us from caring for ourselves in ways that bring us joy and meaning. And so if I could communicate anything, don't be afraid to slow down. You are still going to get there. So it's much better to get there well, to have taken that sip of water, to have gone for that walk, to have eaten a meal, right? Because the time you save not doing those things doesn't really add up. It doesn't give the benefit that you really that we imagine that it will. I mean, and this is something I constantly am constantly reminding myself of. It's not a place I've arrived. It's a constant thing I'm reminding myself. And so if I could share that with anybody as an encouragement, I would, because it is in those moments that we actually see and feel the growth and feel cared for. Oftentimes we think it's going to be in, I got a whole day off and I went and did this wonderful thing. And while it's amazing to take long vacations and do these luxurious things, are truly where our goodness comes is in those everyday moments and making our regular lived days feel like I could do this again. I could come back again, right? And so slowing down can help us get there with a lot more wholeness.
That is so, 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 so powerful, what you just said. That is, and so, so true. It just goes back to when you said when we approach it as consistent support rather than one thing like, okay, that one vacation, you still have to come back to reality and to the day-to-day things in life that are going to be there
Yep,
when you get
yep,
back.
yep.
So what,
Always there, always there.
yeah. And like you say, the day-to-day things, taking time out, slow it down. Don't go so fast. Like you said, it's like the tortoise and the hare race, you know. They think he's gonna get there like that. You're gonna get there, but get there well. It's how you get there.
Right,
You
right.
know, that's so helpful. Oh my goodness. That was a master class in just what you said. But really, 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 because it's so true. Everything is so hurried in life now, you know. We just have to rush. We have to hurry up and get it done. And
Yeah,
you get it done, but how do you get it done? Then you're exhausted, you know, and you're not built up and strengthened as you could be. So that is so valuable. And I tell you, it just seems like I looked at the clock. I'm like, already? Is the time really? Is the time really gone? I just appreciate it so much, you know. And I'll stop. I'm not going to say we're finished, but I'm going to stop
okay.
because that means I have to have you back. Well, to come back again, which would be wonderful. We'd be honored to have you back, have your voice back here at the well, and keep up with the work that you're doing and what you're doing because it's so helpful and so meaningful and impactful. And that's what we really want to do is to make an impact, you know, on not just the faith-based community, but the community at large, but
Yeah,
particularly, you know, yeah, we need all the help that we can get.
you got that right.
All the sources. So, so it is so good. And so I have to thank you for being here. And if you have any other closing remarks that you feel on your heart to make, please do so. And then after that, I'm going to ask you to close us out with prayer.
Sure. I do have one closing thought.
Yes.
I really want to share, and it's come up in my mind a couple of times during this conversation, is that we have to resist the urge of putting ourselves in the bucket of being a helper or the person who receives help or the teacher or the student or the person who gives and then the persons who receive. It does damage on both ends. So when I think about healthcare providers, they've been put in a role that they are just the ones who help. They help at work. When they get home, family calls about all the situations. They are the helpers. And even if they have not made that thought themselves, when we put them in that bucket, it creates this situation where they cannot ask for help. And when we put ourselves in the bucket of only being helped or the only learning or only the mentee, we never value what we've learned along the way and the things that we could do to be supportive of others. And so, one of the things I really want to leave with your viewers is allow it to be okay that you both give and you receive, that you both are taught and you put yourself in a position to teach. When we can share in that kind of back and forth, that's where real community happens. And that's how people can be supported long term, because there's not just one person we're holding up as, if something happens to you, we don't know what we're going to do. That person can get support from us, and then they can give support to us. And so we want to create communities that feel healthy and whole and safe. And one of the ways to do that is to make space to both give and to receive. And so I think that's really important given our topic, but just given our lives in general.
Yeah, that is very important. Thank you so much. I'm glad you shared that. That is because it's just it was just well said. I have nothing to add or take away from that. That was really, really, really great food for thought. So I appreciate that. So with that, viewers, I thank you for being with us today, as always, around the well. And we'll look for you next week, the same time, same place. But at this moment, just be with us in prayer as Dr. Holder will close us out. Thank you so much.
Sure. Yeah. Dear kind and gracious and loving Father, we thank you so much for this opportunity to gather. The prayer is that the words that were said and what was heard could provide hope and encouragement. We pray for everyone who has watched. We pray for our dear sister Beverly Allen and this wonderful work that she is doing. We ask that you would be glorified and that you would allow us to continue to serve and to be served with love. We thank you. In your name we pray. Amen.
Amen, amen, amen. Thank you so much. And I tell you, well, listen, don't forget next week, same time, same place. And until then, I'll say stay safe, stay well, and God bless you.
If things keep going the way they are for you, you will burn out. And so there is a need for you to make space for how you could care for yourself better. Leave space for it to be okay that there are some circumstances that are outside of your control right now. You are learning to figure out how to care for yourself best in the madness of a situation you did not create, yet you're here now. This is a warning and a gentle encouragement around taking hold of what you can take hold of. No one's asking you to change things that are outside of your control. But the things that are, maybe there is space for you to do things a little bit differently to increase the buffer that you have between you and the raging world around you.